Doctors only prescribe medications. They never talk about lifestyle. Hey, I'm Dr. Coyce, emergency medicine physician. Last night on shift, I saw 19 patients in my 8-hour shift. And of those 19 patients, I think I talked to about 10 of them about diet, exercise, sleep, and meditation practices. Now, I did this from the emergency department, and we have a rapid assessment unit where we have to see patients very quickly to try and figure out what their problems are and determine what workup they need, and usually disposition them pretty quickly. I'll give you two examples. The first one was a patient who had anxiety. Now, this was a person who was eating fast food on the run, they weren't exercising meaningfully, they were having terrible sleep. I gave him my elevator pitch for diet in the emergency department, which is encouraging a pattern of foods that are predominantly plant focused and try to eliminate a lot of those convenience and fast foods. The next was exercise, and my recommendation here was between 30 to 60 minutes on every day, if not most days of the week, where he's doing some sort of intentional physical activity where he's out of breath. And this can be super simple, like going for a walk and making sure that you're out of breath while you're doing it. Of course, the patient needs to be able to incorporate some resistance training into that as well, but for someone who's doing nothing, just getting out and doing something every day is a really good goal to start off with. Then we talked about sleep. This person was having late night fast meals right before bed. They were drinking alcohol. They didn't have a consistent bedtime. They didn't have a consistent wake up time. So we talked about all of those things. So to say that doctors only prescribe medications and don't talk about lifestyle interventions, if I can do it in the emergency room, then it's happening elsewhere. I know it's happening. I talked to my colleagues about this in this space. In other spaces, it's in our guidelines for cardiovascular disease to be talking about lifestyle